Well, it was interesting. It was interesting listening to David and comparing our conversations with what I imagined went on in that work group. The schools had the benefit of having people from the Department of Education in strong numbers there, along with the rest of us. And that was a great pleasure because there aren't too many meetings in which education and mental health and public health come into one place. There's about 100 years old history of having totally no interconnections across public health and public education. So much so that in Chicago, for example, the Chicago Board of Health has no connection to the Chicago Board of Education. There's a separate health system in Chicago for schools. So the meeting itself was interesting and very important because it brought us together. And first of all, the first question was, well, what's wrong with what's going on now? What are the things that really need to be examined? Currently, we have, generally speaking, I think it's fair to say, a great separation between classrooms and families, and between the disciplines that exist for helping kids in schools, separation from each other and lack of coordination among them. If you look carefully, the disciplines really have not been brought up into a modern, integrating, symbiotic relation to each other. So psychologists tend to focus more on case issues, case problems. The nurse is doing a great deal with, in a narrow focus of concentrating on condoms and bandages for the wounded. But has very little to do generally with what's going on in the classroom as a classroom. There are, maybe at last count that I'm aware of, there are about 14 different systems of information regarding kids, largely national probability samples, very few of whom actually relate to local communities and local communities over time. So the information systems are separated. The picture that one gets if you look at all of these, and by the way, disciplines like child psychiatry, it's still true that generally speaking you could go through a whole child psychiatric residency and never be in a classroom. And yet one of the largest expenditures in healthcare, of course, is amphetamines for children. And you wonder what criteria a psychiatrist uses in prescribing medication without sitting in a classroom and understanding what the classroom environment is in which the child is chosen as the kid to be involved in healthcare. So we have separation, and we have classroom versus family partnerships which don't exist very well. For the most part, families and classrooms are really disconnected from each other in terms of functional exchange on a weekly or daily basis even, or at all. So the problem is we don't have really a very good system. The recalls for help involve IEP. You know, IEP is an individual education plan. And this means that a child has met criteria of not so easy criteria to meet to qualify for special attention for help. And it's an expensive interdisciplinary group around Charlie as to what Charlie could be doing well, better, and with what kind of care. It takes a lot of time to get there. The team is expensive, and it's a child focus. Okay, so that's a mess. And if you look at the disciplines, for example, one of the cardinal ones is the teachers, if you look at their training, have relatively little training in teaching, but almost no training uniformly in classroom behavior management. NCATE, the national accreditation of schools of education, don't require teachers to be trained in classroom management. Now pause there for a moment. Teacher burnout is primarily related to classroom behavior management or the lack of skills in doing it. And it's a huge problem. So what are we supposed to do about it? I came away last night after good conversations with David Moore on a totally different topic. In the back of my head is I'm thinking, if I understood what the discussion was all about, we're talking about a frigging revolution. Now, what does that look like? It turns out that what our discussions were all about were, number one, we can use a single information system and not 14. We can, in fact, press for an integration of healthcare information, albeit ACA or whatever, and the No Kid Gets Left Behind information system, so that they are, in fact, a single information system which gathers data over time about kids. In addition to which, we can have a focus on the classroom as our unit. 25 to 30 children is a kind of community of sorts. It's a training ground for how to get with each other out of mutual self-interest. And that classroom unit could be a place, instead of psychologists trained to do casework, it could be a place where a psychologist works with a classroom, where the teacher understands and has the skill to see the classroom as a unit and relate with less anxiety to families, where a social worker could be assigned to a classroom and not to individual crisis kids. So the classroom could become, in fact, a unit, a social unit, in which social studies, which happens to be one of the items in curriculum, could be part of the understanding of this classroom and the role in the classroom. It's as easy to learn how to read about the classroom as a unit, as a community, as it is about any other topic that might be written about in a textbook. So we could, in fact, make that happen. This new focus would require a lot of disciplinary training. You could, if you're a child psychiatrist, you would need to be spending some time in classrooms to understand what attention looks like at the classroom level in the daily work of the classroom. You would understand and be able, and we need measures that would give us, we do have measures that would give us an overall picture of every child in a classroom periodically in terms of a simple teacher interview with somebody who in fact is trained to elicit from the teacher how things are going with every child, twice a year, 3 times a year. We did that during the trials of classroom interventions. That's easily applicable and economical. So we're talking about an information system that could be, in fact, a combination of healthcare as well as education. It's the life course perspective of the schooling information system makes it incredibly powerful and useful. In doing the trials, it was essential. But in the daily work of the classroom, integrating services around kids' needs on an information system, for example, would allow child welfare to be cautious and maybe even not transfer children from one foster home to another without knowing that that meant that the child went from one classroom to another, one school to another, one neighborhood to another, with the loss of all social integration at age 6. Come on now, we can make a system out of this. And we need a common information system, and we need a common shared view that the classroom is a unit. When I was at NIH learning to do research, it was just after the Korean War, the Army, the military, had developed the concept of the platoon, the squad, as a unit, and that people were not evacuated, triaged, because they had psychiatric disorders, because it was thought that if you did that, they disconnected from everybody they knew. And the basic relationships in a military unit are the buddies next door to you, down in the next bed, next foxhole. So that kind of notion of a community around a classroom is not a crazy idea. It's in fact part and parcel of what the disciplines need as we retrain the disciplines so that they function together as a unit around the community of the classroom. Well, I think those were major points. Updating schools of education, I never see at any meetings anywhere. The meetings that I go to, in Department of Education, I was so pleased in our work group, we had a real conversation with IES. I mean, they're sitting here now. And it was incredibly useful to hear a perspective that we hadn't really come together with in talking about public health and mental health. So bringing us together was a great experience, and I'm sure there's much more that we're talking about. The engagement with disciplines is going to be a serious and tough subject. We have to train people that train child psychiatrists that, yes, attention deficit occurs in the real world in classrooms of 25 kids. Charlie may be the only one, or it may be the 18 of Charlies in one classroom, and the teacher without any training may be in fact in deep trouble. Teacher burnout is largely caused by classroom behavior management, inadequate performance response, and is debilitating. Anyway, those are the thoughts that occurred to me, and as I sat and listened and participated, I had a wonderful experience. My buddy Hendricks and I, and the people who joined us from all kinds of perspectives in the group. So I hope they'll join in and move the conversation forward. Thank you.
Thank you. And our last report comes from a tag team, Larry Palinkas and Jennifer Tyson, where we integrated both child welfare systems and juvenile and criminal justice to hear their overview.